Hello, everyone. My name is Rosie Conic. I am a member of AAPM&R's Content Creator Workgroup and a Pain Fellow at the Mayo Clinic in Jacksonville. Today, I'm excited to speak with Dr. Oza, who's one of the cancer rehab specialists. Dr. Oza?
Hi there. I'm Sonal Oza. Thanks for having me here this afternoon.
Super excited to hear more about your plans for these sessions. So, could you tell me a little bit about why you chose PM&R?
Sure. I loved everything in medical school, but especially gravitated towards PM&R because of just how much the patient's goals and their quality of life was so central to like the medical care that's given by PM&R physicians. I felt like it was one of the specialties that really emphasized patient-centric care and acted in that way as well. And as I learned more about PM&R, I felt it was a natural fit.
Great. Could you tell us a little bit about the cancer rehab advanced clinical focus day sessions that you've been planning?
Yeah, absolutely. So Dr. Sam Shapar and I have been leading the planning for those advanced clinical focus days. We're particularly excited about this year because we think it will appeal to the advanced learner. We have sessions that will be covering the neurologic and musculoskeletal toxicities of immunotherapies and targeted therapies. These are cancer therapeutics that are being used more and more frequently and are being incorporated into standard of care for certain diagnoses. And we are seeing just such a variety of severity and just in terms of presentation of how these patients are presenting. And I think the PM&R physician is really well suited to evaluating these symptoms and also coming up with a plan to improve their function. We also have a session centered around the rehabilitation needs among patients who are receiving CAR T cell therapy, which similarly to the immunotherapies and the targeted therapies, we're seeing these used in populations outside of the hematologic cancers. And these patients can present with CNS effects, peripheral nerve and musculoskeletal toxicity. So again, just another area that I think would be really informative for our PMR community to be aware of. I think it's relevant not only for cancer rehab physicians, but also to our physicians who work on the inpatient side of things. And then our third session is really kind of gets at the heart of what's like the sort of psychological and sort of like mental impact of being a physician who cares for patients who are not only going through something so medically traumatic with their cancer diagnosis, but also learning to adapt and deal with new physical disabilities as a result of their condition and treatment. And oftentimes, we're alongside patients as they're going through this, and it can be so gratifying, but also heavy at times. And so that third session is really to be like an open environment to go through some experiences and have that open discussion and really just like connect with others from the community. So I'm hoping that it is, kind of intellectually stimulating with those first two sessions, but kind of also getting at the heart and kind of what we do.
Yeah, in a way you touched on this, but is there a specific session that you think is going to be particularly suited for somebody who's more of an expert in cancer rehab, such as you?
I really think all three sessions would be relevant. I think maybe perhaps from a content perspective, I am hoping that the first two sessions would be particularly relevant. With that first one, with the immunotherapies and targeted therapies, we're lucky that we're also going to have an oncologist speak on the panel. So she'll go into perhaps a little bit more detail on the underlying mechanisms, pathophysiology of some of what we're seeing. So I do think that all three sessions would be relevant.
Nice. I'm really looking forward to it as somebody who has an interest in cancer rehab and cancer pain as well. So, is there anything specific that you're looking forward to at the annual assembly this year?
I think it's always wonderful to, connect with others in the field. And sometimes in our day-to-day practices, it can be a little bit siloed. And so it's always nice to connect and brainstorm new ideas with like-minded individuals.
And do you have any fun pre or post conference plans for Salt Lake City?
Yeah, so Salt Lake is such a beautiful city. The backdrop are the Wasatch Mountains, and there are hiking trails that lead further up into the foothills just right from downtown. And so definitely going to try and squeeze in a few hikes while I'm there.
Great. Maybe I'll see you on one of the trails.
That would
But
be great.
yeah. Hardest question though, what's gonna be your Halloween costume this year?
It's a tough one as someone who usually has a few costumes. We Teenage Mutant Ninja Turtles did re-release one of their original movies, so that might be a contender. Um, as an elderly millennial who gets to work with a lot of Gen Z students, it maybe I'll be an elderly millennial trying to emulate a Gen Z. We'll see.
Well, sounds like we'll have a fun time.
All right, sounds good. Hope to see you there.
Yep, can't wait. Thank you so much for joining us today and looking forward to seeing you all in Salt Lake.
All right, see you then.